A patient of COVID-19 just received an insane medical bill for her treatment. So now this is the story of Danny Eschini. And she had presented with the normal, usual symptoms of COVID-19: chest pain, shortness of breath, a migraine, all at once. She called her doctor. She was immunocompromised as she has lymphoma. So now she went through the BASB of different tests. Said maybe it's your medication. Maybe you have maybe you have an issue with your lungs, pneumonia, and then finally, when she was able to get tested for it, she ended up getting tested positive for COVID-19. So now she was treated for it, and now she's okay. So all of this happened back in February, right? Now the bill that she received from this is astoundingly abhorrent. She received a bill for $34,927.43. Wow. So now when she received that bill, she was like, wait, what? She said, I personally don't know anybody who has that kind of money. Well, most of us don't. And that's why it's such a shock when you see our healthcare system in action, because our health insurance system in action. So this is the problem, right? Now, like 27 million other Americans, Eschini was uninsured when she first entered the hospital. She and her husband have been planning to move to Washington, D.C., so she could take a new job. She hadn't started it, and of course, there's a lot of insurance. Like if you go to a new job that offers health insurance, it normally doesn't kick in for about 90 days. So if you have an emergency in between that, the time that you quit your job and don't have or previous job and don't have health insurance, and you go to the new job and their health insurance plan doesn't kick in, if you get sick in between there, then you're basically screwed. And that's it. I mean, and that's exactly what happened to her. Now, public health experts predict that tens of thousands of people will also be in that same position as Danny Eschini. In fact, Congress has yet to address the problem, as noted. Now, on March 18th, it did pass the Families First Coronavirus Response Act, which does cover the testing costs, but nobody has addressed treatment. And that's where the lion's share of the costs come from. It's not just testing, it is treatment. And it's also the fact that so many people are uninsured. Or even if you have insurance, the costs are still astronomical. In fact, a new analysis by the Kaiser Family Foundation estimates that the average cost of COVID-19 treatment for someone with employer insurance and without any complications would be about $9,763. $9,000. If you have complications, you could be paying $20,000. That's with employer-sponsored insurance. That is insane. Now, most private health plans are likely to cover the services needed to treat the complications, but alongside of that, you end up having deductibles. You also have, of course, the annual deductible, by the way, is about $1,600. For individual plans, the costs are higher. The average deductible for an individual bronze plan was about $5,861, according to Health Pocket. You also have out-of-pocket costs of somewhere around more than $1,300. And those costs were similar regardless of complications. And so not only that, but you have copays too. Those costs are about 15 to 20% for an in-network doctor. If you end up getting an out-of-network doctor, well, that actually increases the cost quite a bit because your insurance plan will not cover if that doctor happens to be out of network. So that's insane. And if you're not insured, like Danny Eschini, it's even worse. And so, look, there is some action on this. Several states, including Maryland, Massachusetts, Nevada, New York, Rhode Island, and Washington, have created special enrollment periods to allow more people to sign up for insurance. But again, if you can't afford that, well, then that's not going to help you all that much. No, what we need is universal health care. We don't need private insurance. We need the government. I mean, look, in the intervening crisis, just expand Medicaid to everybody, right? We already have a system in place. But in the long term, we need Medicare for all. Because right now, these bills are ruining families. These plans, I mean, this this entire situation that we are in right now is unprecedented, and we are vastly underprepared for what's going to happen. Again, the worst has not happened in the United States yet. There's going to be a shortage of hospital beds, and there's going to be a shortage of ventilators and other PPE equipment, or just PPE equipment like masks and gowns and things like that. But that's not even factoring the long-term cost for people who don't have insurance. People who, yes, will likely survive, like this person who was lucky enough to be able to survive a diagnosis and treatment. But those bills, they don't go away. How do you handle $34,000 for a bill? I mean, that's the problem with our health insurance system. That's why we need to change. And that's why we need politicians that are bold enough to be able to propose and enact that change. And unfortunately, I don't see that happening even under this massive crisis. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a patreon.com/TYTNation set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know how I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.